I'm the frontline supervisor for our mental health intensive case management program, which helps veterans who have severe and persistent mental health issues, specifically schizophrenia, post-traumatic stress disorder, and bipolar disorder. We have 8 case managers that go and meet with veterans actually out in their homes in the community. We can assist with things like medication management to make sure veterans are taking their medications. We help remind them to get to their appointments. We can even take them to their appointments. It's just really tailored to whatever their specific needs are and goals are, just to keep them happy and healthy and in the community. We have 4 social workers on our team, and they can provide psychotherapy in the homes, as well as case management, of course. We also have 4 nurses, so along with setting up those pill boxes and things like that, they also give veterans their antipsychotic injections in the home, which saves them from having to come into the facility. The nurse is managing that shot for them, making sure that they get it on time, and they don't even have to leave their home. Sometimes they will say, "Oh, I don't want to take a spot from somebody else who really needs it." I hear that really often. You deserve it just as much as the next person. Everyone is deserving of our service as long as you have that need and that mental health diagnosis. Try it. It's if you don't like it, no big deal. Self-refer by calling me, or they can ask their provider to enter a consult through our electronic medical record. Either way.
They usually call me Dr. Nate. So I am a psychology program manager for the VTech program. So VTech is Veterans Transition and Empowerment Center. So it's a specialty mental health outpatient program for veterans with serious mental illness. The VA designates that as a veteran with a diagnosis of either schizophrenia or other psychosis, bipolar disorder, major depression, or severe PTSD. And the person's having trouble in a lot of different areas of functioning. So many of our veterans, especially before they come to a program like ours, are struggling with isolation. And so this is a supportive learning environment where the veterans really support, care for one another. It's almost like a family here. We always say we're not here to criticize, reject, ridicule, put anyone down. We're all here to help each other learn and to grow. And many of them have specifically stated if it wasn't for our program, they wouldn't be here. So one of our goals is to try to help people stay out of the hospital, get more integrated into the community, and have a better overall quality of life. For many of them, when they come in, they're usually anxious, nervous, which is to be expected. But once they get into some of our groups and start talking to one of the, some of the other veterans in the groups, we have a couple veterans that sort of take it upon themselves to sort of introduce themselves, make the new veterans feel comfortable, and then once they're in, it's like they're connected. We have a consult that can be referred from either their mental health provider, their primary care team, or if they hear about us, they can contact us. We also do self-referrals as well, as long as people meet those diagnostic criteria. So, and if they're not sure, they can ask us and we can either find out, or we can do an assessment to determine if they meet our eligibility criteria. But there is no equivalent in the community for the type of services that we offer here, that's especially on an outpatient level.